Hello, everyone. My name is Maria Hill. I am the Communications Manager for IWCA Global, and I just wanted to welcome you all here today for another exciting IWCA Connects. We are very excited to be here with an amazing panel of people from the International Labor Organization, Vision Zero Fund. And before we jump in and get started, just wanted to let everyone know that if for some reason you have to leave early or you miss part of the presentation, these will be uploaded later on the IWCA YouTube channel, so you can go back and revisit any of the information that you might want to dive deeper into. And as we move along, there will be 3 different presentations, and I would encourage you that as questions kind of come into your head to jot them down somewhere. We will have plenty of time for Q&A at the end of the presentations, so I encourage you all to take advantage of the fact that we have these amazing people here live with us right now. So without further ado, I will go ahead and introduce our panelists. So in collaboration with IWCA, the International Labor Organization Vision Zero Fund carries out research and activities with a gender-sensitive approach to occupational safety and health. In our webinar today, you will hear from 3 experts who will talk about what are the main risks to which women working in the coffee sector are exposed to during the production process. How do they manage these risks to avoid the occurrence of accidents at the workplace? And what can you do to further ensure their right to occupational safety and health? So our first presentation is from Akkert Dupert, Global Manager, Vision Zero Fund. Akkert is the Global Program Manager of the Vision Zero Fund at the International Labor Organization in Geneva. Before joining the ILO, he was Director of Monitoring and Vice President of Programs at the Fair Labor Association and Professor of Law at the University of Stellenbosch in South Africa. I'm sorry if I pronounced that incorrectly. Where he specialized in labor law and social security law. Sorry. Did you want to go ahead, Akkert, and then I can move forward? Yeah.
Do you want me to do mine now, Maria, and then you introduce each of the colleagues when it's their turn? Happy to do so.
Yeah, that would be great.
Okay,
yeah.
Perfect. So thank you very, very much, Maria. Thank you. We're super excited, really excited to be here today. To talk about the collaboration with the IWCA, which I think has been incredibly fruitful. It's really been important to also help the Vision Zero Fund to look at the issues that we look at through a gender lens. I think the collaboration has worked incredibly well already in Mexico and in Colombia, and you'll hear from my colleague Rodrigo to talk about that. And we'll also hear from my colleague Christina, who manages our project in Vietnam, who will talk about the work that we're planning to do with the IWCA in Vietnam. So we really started very small in Mexico. We're expanding to Colombia and also now to Vietnam. And I think it's really exciting. So I've been asked to talk a little bit about occupational safety and health, to talk about the way that the fund operates, the fund works. So if you allow me, I think I'm going to start my timer now. I've got about 12 minutes. So I'll really try to stick to the time. So let me share my screen very quickly. I think this should be it. Hopefully you're seeing it right now. Now I just need to be able to move the slide down, which I can't do, of course. Okay, there you go. So allow me very, very quickly just to talk about the origins of the Vision Zero Fund. As Maria said, we are part of the ILO. The Vision Zero Fund was established in 2015 by the G7 under Germany's presidency. And you'll see the picture on the left, and you'll probably all recognize it, which is the Rana Plaza tragedy in Bangladesh, where more than 1,100 workers were killed and more than 2,500 were injured. And the G7 decided to establish the Vision Zero Fund to ask the ILO to administer the fund, to implement its project, to really try to work on the issue of occupational safety and health to prevent the kind of accident that you saw in Rana Plaza. Of course, Rana Plaza's, the failures were numerous. There was an absence of a culture of prevention at workplace and national level. The laws were weak. The enforcement of the laws were extremely weak. And very importantly, the workers and their families did not have access to employment injury insurance. So the Vision Zero Fund also works not only on occupational safety and health, very narrowly defined, but we also work in the countries in which we work to strengthen the social security system, the employment injury insurance system, to ensure that when accidents occur, that workers have access to compensation. Now, very quickly, just where we work, very quickly, you'll see that we're spread out around the world, very evenly across the 3 continents. We work in different supply chains. At the moment, we are focusing on agriculture, including coffee. There's a strong focus on coffee, which is why this collaboration with IWCA is so exciting for us. But we also work in other high-risk sectors like construction and also in garment and textiles. And as I've mentioned already, my colleagues are here who manage the projects in Latin America and also the project in Vietnam to talk about the work that we do there. Now, very, very quickly, just to give you a sense of what we are dealing with here, what is the challenge that we are facing? Now, I'm giving you these numbers. Of course, we are happy to share these slides with you afterwards so you can have a look at it in more detail. But let me make just a few points about the numbers and the figures that you are seeing right now. We know that this is really the tip of the iceberg. We know that accidents, injuries, diseases are severely underreported. I think there are estimates telling us that it ranges between 50% to 2/3 of all accidents and injuries and diseases are not reported to the national authorities. And that is very troubling. Despite that, despite the fact that we know that 3 million workers die every year, that's just the tip of the iceberg, the numbers are still jaw-dropping and staggering. If you break it down, which I always like to do, just to make sure that people really get a sense of the scale of the problem, it is 7,500 people who die every day because of their work. 300 people every hour, 5 people every minute. So by the end of our 1-hour session, 300 people would have died because of their work. Secondly, you will notice, and it's maybe not always apparent, that the ratio between deaths from injuries, like the Rana Plaza incident, and deaths from occupational diseases is about 20-80. In other words, 80% of all deaths, more or less, result from occupational diseases and 20% from accidents. Now, inevitably, one focuses a lot on these incidents like Rana Plaza, like Tazreen Fashions, but to be honest with you, it is occupational diseases that is really the silent killer, and 80% of deaths result from occupational diseases. The third point I want to make about these staggering numbers is that it's not evenly distributed. Without going into details, we know from research that the majority of deaths, in particular related or resulting from injuries, occur in Asia and Africa. 75% of deaths resulting from accidents occur on those 2 continents for a variety of reasons, which I'll not go into. If you're interested in it, we can talk about it a little bit later. And then the fourth point I want to make is, besides the awful human costs, there is also a very severe economic cost. Just to give you a sense, estimates are that 4.4% of GDP is lost every year as a result of occupational injuries and diseases. And then the final point I want to make, and you look at the number on the left bottom of the screen, 20%, only 20% of workers have access to occupational health services around the world, and about half of, or maybe 60% of workers are excluded around the world from what I mentioned earlier, employment injury insurance systems. In other words, should they get injured, should they contract an occupational disease, they don't have access to the medical services that they need, and they do not, should they survive, have access to any kind of compensation as a result of the fact that they're unable to work. Now, very quickly, the ILO has been working on occupational safety and health for more than 100 years. As you may know, we had our centenary celebrations in 2019, and there are all these, and I don't expect you to look at it, to go through it, but just to give you a sense of there's so much activity around occupational safety and health, so many standards that the ILO has issued. There are standards related to specific risks. There are standards related to specific branches of activities, so agriculture, constructions. There are standards related to protection of specific groups of workers, in particular young workers. And then there are the more general provisions. And that includes the two most important, I think, conventions that I think you should be aware of, namely Convention 155 and Convention 187. Convention 155 is the Occupational Safety and Health Convention, and 187 is the Promotional Framework for Occupational Safety and Health. And very important about these two standards is that on the 3rd of June this year, so just a little over 3 months ago, this is what happened. That picture shows you the moment that the General Affairs Committee of the International Labour Conference recognized, very importantly, occupational safety and health as a fundamental principle and right at work. The wording that's used is the right to a safe and healthy working environment. Now, I don't want to get too technical about this. I think this is a significant moment that you see on the screen there. It was confirmed by the International Labour Conference a few weeks later, but it's very important because what it does, and let me just tell you what it means. It means now that occupational safety and health is one of the fundamental principles and rights at work, joining freedom of association, the right to collective bargaining, the elimination of all forms of forced or compulsory labor, child labor, and the elimination of discrimination. And what I want you to very quickly look at is just that initial paragraph at the top. It says all members, and I'm talking here about governments who there are 100, I should remember this, I think 187 countries that are members of the ILO, even if they have not ratified the convention in question, have an obligation, purely because they're members of the ILO, to respect, to promote, and to realize the principles underlying these fundamental principles and rights at work. In other words, in the ILO, how it works is there are conventions, countries ratify these conventions, then they have to report to the ILO annually on how they are implementing those conventions. What this declaration does and what it says, that even if you have not ratified the Occupational Health Safety and Health Convention 155 or the Framework Convention 187, you still have to respect, promote, and realize it. So it is for us, at least for us working in occupational safety and health, it really is a game changer. And I can talk a little bit more about that if you want to know what the implications of this will be, but it will mean that the donor community in particular will coalesce around occupational safety and health in ways that they have not done before. I think there's going to be much more of an emphasis on projects, on technical assistance to countries to help them to improve their systems and to be able to ultimately, if they have not yet done so, to ratify the two fundamental conventions on occupational safety and health. Very quickly, I've got 2 minutes to go. Just to tell you how we work, and my colleagues in Rodrigo and Christina will be able to expand a lot more on this because they're actually the ones who are implementing our projects and are really dealing with us on a day-to-day basis. But let me just put it to you in a nutshell. The Vision Zero Fund, in its projects, we do not assume that we know what our stakeholders want. So what we do is we pride ourselves on the fact that our interventions, the work that we do, the collaboration with IWCA, we'll talk about that today, is evidence-led. So what we do is we carefully select supply chains where we think we can make the biggest difference. There's a whole process that we go through. Then we do what we call a comprehensive assessment of what we refer to as drivers and constraints for occupational health improvement in the country and in the supply chain. So we look for areas, we look for entry points for the fund to be able to make the biggest difference. The fund always has a small team in the country, so we cannot do everything. So we need to really target our interventions to make the best use of our resources and to have the biggest impact. Then we design our interventions together with the stakeholders, and then we implement it as well under a collective action umbrella. In other words, we know that the issues of safety, occupational safety and health are so big, so multifaceted, so complex, that we cannot do it alone. And we cannot expect one stakeholder only to address the issue. So we cannot lay the blame only at the door of the Bangladesh government. Yes, they had a role to play in Rana Plaza, but we cannot expect them to fix all the issues. The workers have a role to play, employers have a role to play, global brands in particular have an important role to play. And then the final point there is about sustainability. So what we try to do in the countries in which we work is to build the capacity of institutions, of people within the institutions in the country, so that ultimately when the Vision Zero Fund departs the country, leaves, that we know that the work that we've done will not end with our departure, but that it's embedded in institutions, embedded in people, and it will continue. And then very quickly, just finally, before I hand over, my 12 minutes are up, just to say that we do recognize, and this is the important work that we're doing with you, and I think this is what your organization has helped us to also focus a lot more on this issue, is that health hazards often affect different types of workers in different ways. So men and women can do exactly the same work, but we know that there's research that has been done, and Rodrigo will talk a little bit about that, that the hazards affect the different genders in different ways. We also have a segmented market, so often, or economy. So you often have sectors in which women predominate, and we need to be very careful and need to be very attentive to the way in which occupational risks and hazards affect women, in particular in women-dominated sectors. So there are guidelines that I referred to there. When we send you the PowerPoint, you can click on that, it'll take you to the guidelines. But there's a real need, and this is what I think why the work with the IWCA is so important, is there's a need to improve gender sensitivity and collecting and disseminating data on occupational injuries and diseases. Something that we're very focused on, something that we're very committed to, and I think together with the IWCA chapters, and my colleagues will now talk about that, I think we can actually begin to improve the situation from what we currently have in terms of data on the gender differences related to occupational safety now. So Maria, thank you so much. I went a little bit over time. I do apologize. I know my colleague Christina said she'll go a little bit shorter, so hopefully we can still make up some of the time. So thank you everybody for listening to me, and looking forward to the discussion.
Thank you so much. I really appreciate the overview and the level of detail. A lot of that information and the statistics is just really great information, I think, to lay the groundwork to dig into some of the details of the important work that ILO and the Vision Zero Fund is doing. And thank you so much. I know that it's a little late where you are, so I appreciate you being online with us too. And with that, we are going to move into our next presentation from Rodrigo Mogorip. I'm going to butcher your last name. I'm sorry. Mogorip. Can you?
Mogrovejo.
Mogrovejo. I kept repeating it to myself, trying not to slip up. Mogrovejo. Got it. Thank you so much. Rodrigo is here, and as Ockert mentioned, he works in Mexico, Colombia, and then most recently with our IWCA chapter in Honduras. And so a brief overview of Rodrigo. He is the Chief Technical Advisor for the Vision Zero Fund, Mexico, Colombia, and Honduras. He started work for the ILO in 2011 and has extensive experience and knowledge in working conditions, gender, occupational health and safety, child labor, cooperatives, productivity, and value chains. He has a PhD in development studies and applied economy. He has 3 master's degrees, one in regional development, another in social economy and local development and international aid. So he is going to go into a little bit more detail about the work that's being done by the ILO and Vision Zero Fund in country specific to coffee. So please take it away, Rodrigo.
Okay, thank you very much, Maria. I'm very excited to be here because I work very close with IWCA chapters in the region, in Latin America regions. I think you are an excellent leaders in these countries. And I would like to share these results and lessons learned in these implementations. I would like to start with the work developed in Mexico and Honduras. Since VZF, we implemented an OSH gender-sensitive approach, which means collecting sex disaggregated data, analyzing gender patterns of occupational hazards, and risks, and designing intervention that address these differences. In Mexico and in Colombia, with the support of the IWCA chapters, we implemented this all-gender approach in the coffee value chain. We started with the train-of-trainer processes to build OSH capacities in IWCA chapters. We use, I would like to highlight that we use a WIND methodology. It's an ILO methodology. And in a couple of weeks, we will launch an online free training WIND course in English and in Spanish. I encourage you to take this course. Well, I'm going to continue with the presentation, sorry. In the implementation, we continued face-to-face training with small producers in different coffee regions. In Mexico, for example, in Veracruz, Puebla, and Hidalgo, and in Colombia, in El Quindío. In these training processes, we took advantage to collect information from the producers through surveys and structured interviews. In summary, the idea was not only to generate the first reports on OSH women coffee producers, otherwise to generate capacities in coffee women organizations. We trained around 200 producers in both countries with this exercise. Regarding the results of the study in Mexico, we found interesting results of the frequency of exposure of women producers to OSH hazards. We found that the top hazards are ergonomic, physical, environmental, biological, and mechanical. For example, when we refer to these exposures, we refer to ergonomic as the job often requires standing, repetitive movements with arms above the head, lifting and carrying heavy loads. For example, physical, environmental, women are constantly exposed to high temperatures, humidity, and sudden weather changes. Biological, women are often exposed to bites from snakes, insects, and other small animals. Mechanic, tools are often broken or in poor condition and lack protection. In the case of Colombia, because you can see the results of Mexican study, but in the case of Colombia, we are finalizing the study and we are going to publish this study in the couple of weeks. The first four hazards were biological, physical, chemical, and mechanical in different positions. In this exciting to note that other type of previous surveys in Colombia showed that for women temporary or seasonal workers, the mechanical dangers was the most important and psychosocial was among the four main risks. I think this is very important to highlight that we find differences in this kind of hazards. Regarding accidents in the workplace, 72% of the women production companies in Mexico indicated that they had suffered some accidents. The most common accidents were blows, strain and sprained muscles, heat stroke, and lacerations. 24% of female producers reported being diagnosed with a work-related illnesses in the last year. 27% related to muscles, bones, and joints. Another 27% to the digestive system and the liver. 40% did not stop working despite this diagnosis. 33% were sick from 3 to 7 days. In the case of Colombia, among the most frequent injuries suffered by the women consulted are blows, musculoskeletal injuries, and wounds. The leading cause, about 50% of cases, is related to falls on uneven terrain, inclined surface, and receiving greater involvement in the hands, 32% at least. A low proportion of women coffee growers in Colombia reveals health alteration. 17% of the women who answered the survey have been diagnosed with some illnesses, and mainly women over 40 years old. The most frequent diseases have been located in the muscles, bones, and joints. Regarding the work with IWCA chapters in Mexico, and in this case in Honduras, in Mexico, an implementation agreement was signed and ILO methodologies were adapted to Mexican reality. For example, guidelines for notifying and recording work accidents for worker and managers. Also, a methodology for hazard identification and risk assessment. These tools were applied to 48 farms in essential coffee production areas of Mexico. And 25 OSH kits, including poster and signage, were provided to some 25 farms. On the other hand, a virtual platform was established in the Mexico chapter with a web app to identify hazard and assess risks and promote a virtual training course. Finally, with the chapters of Honduras and Mexico, radio soap operas were adapted based on a previous one made in Colombia, called My Farm, My Home, and Treasure. With 10 episodes, the radio soap opera tries to create an OSH culture for coffee producers in both countries. The radio soap opera in Honduras was launched yesterday, and the Mexican one will launch tomorrow, obviously with the IWCA chapters in each country. I think I spent my time, apologize, and thank you very much for your time and your attention.
Thank you so much. That was also a lot of really great information. I appreciate all those statistics, and it really illustrates how important the work and the research that ILO and the Vision Zero Fund is doing, at origin, working with people. I think one of the things I appreciated the most too is how Ockert talked about how you don't assume that you know what a community needs, and you really go in and make connections and listen to what they're saying to try to find the best strategies and outcomes. So thank you so much. I do look forward to the publishing of the Colombia research, and to let everybody know, once that is published, we will also send that out through the IWCA newsletter and social media. So keep your eyes open for that if that's something you are interested in looking at. So thank you so much. And then for our last presentation, we have Christina, and Christina brings another perspective from origin, and she works with ILO in Vietnam. So I will give her a quick introduction, and after her presentation, we will have a short video that you will be able to hear some voices from some of the programs and research they've been working on. So that's very exciting as well. So Christina Kurse is Chief Technical Advisor for the Vision Zero Fund Vietnam. She holds a master's degree in development finance. She has more than 10 years of experience in managing technical cooperation projects for the ILO, including assignments in Lazoa, Lao, PDR, and Vietnam. Her areas of expertise include occupational safety and health, labor standards, and social dialogue. Welcome, and we're excited to hear your presentation.
Thank you very much, Maria. And yeah, thank you also for giving me the opportunity to be part of this panel today. It's really exciting to share with you our, cooperation with the IWCA Vietnam chapter, which is very new. And I have prepared for you a few slides. Let me just share my screen. Okay. So before I go a little bit into more detail of, of what we are going to do with the IWCA in Vietnam, let me give you a little bit of background information about what the Vision Zero Fund project in Vietnam does. So stakeholder engagement and promoting collective action really plays a key role in our work. And we are working with multiple stakeholders, including the Vietnam Chamber of Industry and Commerce, the Ministry of Agriculture, the Vietnam General Federation of Labor. We work with the private sector, with public companies, with cooperatives, with the Global Coffee Platform also, and also with smallholder farmers directly, especially when we do when we provide training, but also when we do the training follow-up visits. And as far as our activities are concerned, so far we have been focusing on OSH capacity building for institutions, but also at workplace level. And our aim has been, and that's very similar to Rodrigo's approach, to use the ILO's wind training methodology. And we have introduced this methodology into the work of, for example, the Ministry of Agriculture or also NGOs. So particularly institutions that work already with farmers. So institutions that offer training that promotes a good coffee cultivation, sustainable coffee cultivation practices. And we are now at the stage where OSH, as per WIND methodology, is being integrated into existing programs. But the Ministry of Agriculture, for instance, they have also, adjusted the WIND training and have included now chapters on occupational safety and health in their nationally accredited training program on coffee cultivation for Robusta, which means that OSH is now being disseminated nationwide to the coffee sector, but also with, a very promising potential also to being adjusted and being replicated in other good practice documentation for other agricultural sectors. So then we also are training not only at the level of coffee cultivation, but also at the level of coffee processing. And there we have been working in particular with the Vietnam Chamber of Industry and Commerce, where we have introduced training of trainer courses. And then those trainers, they had already a first round of disseminating training to companies. That training approach is focused more on the needs of larger companies, where we have also, included elements of SCORE, for example. And another very important, vehicle for us to disseminate OSH knowledge are dedicated supply chains of international coffee buyers in Vietnam. So they can also play a really important role to disseminate OSH knowledge to really thousands of coffee farmers. Our training also then has so far been lacking, I must say, gender elements. We were not very gender responsive. So, but through this opportunity now for us to collaborate with IWCA, we really appreciated that we can do better now. And so let me go to the next slide. So looking at the planned cooperation with the IWCA chapter in Vietnam until the end of this year, there we are aiming to doing some research through focus group discussions, where we aim to gain better knowledge of the occupational safety and health needs of IWCA coffee farmer members in northern Vietnam who produce Arabica. But also part of the focus group discussions will be baristas in Hanoi. So they will be facing very different OSH risks, of course, through their different working environment, where they may face, for instance, in their indoor working space, lack of fire safety, maybe lack of machine safety, or also safety risks while they are commuting back home after long working hours in the evening. And so the findings of the focus group discussions, they will help us to design activities to respond better to gender needs through, for example, the development of gender-sensitive training modules, suggestions to improve the user-friendliness of personal protective equipment to make it especially more user-friendly for women, but also the promotion of occupational health services that address the occupational health needs of women in particular in relation to the jobs that they perform during work. Then in 2023, we aim to continue our cooperation with the IWCA, but then also supported by a Starbucks grant. And there our focus will also be on OSH capacity building for 3 target groups, including IWCA staff, IWCA farmers, and also baristas. And we will have to do an OSH mapping exercise first to get a better understanding of the OSH conditions in the workplaces of the farmers, but also the baristas. For instance, among coffee farmers in northern Vietnam, in their coffee farmer communities, at their workplaces, we will find as a main hazard very steepy, slopy terrain where coffee farmers work, which can cause, for instance, falls or trips. And then also coffee farmers, they are, especially at the beginning of the coffee harvest, exposed to cold spells, which also represent an important hazard that we need to address. Then the OSH mapping will also provide us, of course, with important baseline data that we need to do the impact monitoring of our training later, and also to document OSH improvements. So when we come to the actual training of our work, there we will aim to promote OSH knowledge and dissemination through participatory training methodologies, then the development of low-cost OSH improvement measures, and also a training rollout in farmer communities. So these are very key elements of the WIN training program that Rodrigo already introduced to you later. And we also aim to include in our TUG training new topics such as women farm workers' well-being, or the development of OSH leadership skills that the trainers may need when they start conducting OSH training at community level. Then a key element of the WIN training rollout strategy are follow-ups by the WIN trainers to provide advice on OSH improvements, and also document results and promote experience sharing among training participants. So we find this a very important element, that we bring together trainers, WIN trainers, but also their trainees to promote their experience with applying good OSH practices, and also share their achievements. You know, when they develop their own low-cost improvement measures to address risks, and that can be very motivating for others. To roll out OSH training in IWCA farmer communities, we would need to explore, you know, who could be our partners at community level, for example, the Women's Union, but maybe also the Farmers Union or Agricultural Extension Services. And there may be also opportunities to cooperate with the private sector, not only when it comes to training rollout, but also when it comes to addressing very specific OSH problems. So what do we want to, you know, aim at? What do we want to achieve with our collaboration with IWCA? Let me summarize. So to become better in designing and implementing gender-responsive OSH improvement measures that address the specific needs of women. Then secondly, to build OSH capacity in a sustainable manner, in that we have a pool of skilled OSH trainers available among IWCA staff, among IWCA members, to do the training rollout and follow-up visits, but then also thirdly, to reach with our OSH improvements all members of a farmer community, to develop OSH solutions that all community members can benefit from. For example, by improving the conditions of public roads that are frequently used by farmers when they drive to their fields. So I hope that you found the few slides that I shared with you interesting, and I believe that we are also having IWCA Vietnam representatives among us, among our audience, who may wish to add their insights to this presentation. Thank you very much.
Thank you so much, Christina. It's always great to hear about the collaborations that we have going on in multiple countries, and I am very excited to share this video. I really appreciate you providing this for us, so I will go ahead and share my screen and get that going.
Mi nombre es Briseida Venegas Ramos, soy de la comunidad de Izcatla, municipio de Izhuatlán del Café, Veracruz, orgullosamente campesina, pequeña productora de café. Estar dentro de la zona cafetalera es levantarse a las 6 de la mañana, ir al molino, llegar, hacer tortillas. Después de ahí el checar si voy a ir a sembrar planta, voy a ir a injertar o cuando es el tiempo de cosecha, ir a cosechar y maquilar. Acabas hasta las 9, 10 de la noche. Sí es cansado, pero cuando tú ves reflejado tu trabajo en alguna marca de café o un precio justo, es para nosotros algo motivante. Mi trabajo en el café pues es, digamos, una herencia familiar, entonces ya soy la tercera generación. Tengo gran amor al café y el producirlo y saber qué calidad tengo en taza y también el que es mi identidad, es mi raíz, es para mí un orgullo el ser mujer campesina y mujer cafetalera. Te ves contenta, te ves libre, te ves enfocada en tu trabajo, entonces es algo que como mujeres te ven que eres una mujer fuerte y una mujer que puede salir adelante. En este curso de la OIT de seguridad y prevención en el trabajo, aprendí a que debo de checar mis máquinas, a ponerles protección, también a checar mi escalera cómo está, a ponerle alguna protección, también el no cargar tan pesado. Estos cursos son importantes para mí porque también los puedo transmitir hacia los demás compañeros y el que tú les transmitas lo que otra persona te transmitió es algo favorable porque nosotros trabajamos con maquinaria, incluso también con asadones, con machetes. Tener eso en cuenta es importante y valioso porque pues cuidamos nuestra vida, que es lo primordial, y también nuestra salud y hacia los demás. Pues siempre hay algo que te va motivando como familia, tener un buen grano, un buen café, entonces cuido el medio ambiente y lo primordial, cuidamos nuestra salud y ahora también cuidamos lo que es la prevención en el trabajo. Es algo que nosotros nos llena de orgullo y el ser mujer.
All right, and I think with that, we will move into the question portion. So if you have a question from any of the presentations, you can go ahead and drop it right into the Q&A chat box, and Blanca and I are watching that. But I think, Blanca, did you want to start with your question for Rodrigo?
Thank you. Yes, this was a very inspiring video. Thank you. Thank you for sharing. Rodrigo, we've heard that there will be a campaign launched in Mexico. We would like to know the objective and how can IWCA be involved?
Yeah, thank you, Blanca. The campaign is part of an implementation agreement that we signed with IWCA Chapter in Mexico. And part of this implementation agreement is that the radio soap opera, and we adapted one radio soap opera because we developed the first time in Colombia this radio soap opera, which was a successful radio soap opera, and right now we are launching this radio soap opera tomorrow, with the most important key actors in the coffee value chains in Mexico. And we are the radio opera has 10 episodes, and I think it's a good opportunity to develop. And in the next regional event, coffee regional event, the IWCA chapter in Mexico is going to implement a lot of training courses as well in OSH matters, topics. And in this way, I think that we obtain the result that we focus on to enforce and different capacities in our stakeholders in different countries.
Okay, you want to
no,
add something else?
Yeah, thank you so much. I think it was a really good question. I think Rodrigo really answered it very well. I just wanted to add that we have also received a small amount of funding from the European Commission to continue the work, the good work that Rodrigo and Christina and others have done in countries, and to elevate that to the global level, and to really do a lot more work at the global level on occupational safety and health of coffee farmers more generally, but also women in particular. So just to say that in terms of the campaign, that project, I think we're anticipating that it will start in October, and that will involve a global campaign. In other words, we want to work together with our partners, with the brands, the big global brands, but also our partners like IWCA, to also expand the work that we do, at the country level and make it globally known, and start with a global campaign. So just to alert you, so that you can pencil it in, and you've got a heads up on that between October this year and the end of next year, we're going to be working also at the global level to raise awareness of coffee farmers' safety and health. And I think the gender component, the work that we've done with you in countries with the IWCA, will be a very important component of that global campaign.
Oh, this is nothing but good news. Thank you for adding that. I have a comment here, a comment from Rosy Cantu, the chapter president in Mexico. She says, "Good morning from Mexico. We are very excited with the campaign in Mexico and so proud of Briseida in that video. Gracias por la confianza, Rodrigo." Thank you for trusting us. And I have another question from Uday Kumar from India. Is any work in the field is in action in the Indian coffee producer area? So asking about if anything will be happening anytime soon in India.
So that's a good question. I think we're not. So the short answer is we're not yet working in India. We have ILO projects working in particular in the tea sector, but not in coffee. We're always looking to expand, Blanca. So, we're also dependent on donor support. So we're beginning to develop our next strategy, our next 5-year strategy, and it's always an opportunity for us to expand to other countries, to expand the work that we've done in the countries in which we're working right now to others. So India has always been an important country for us. We have a very good ILO office, strong ILO office in Delhi. There's great technical expertise in the area in the ILO. So certainly India is on the radar, and we'd be happy to continue the conversation. And again, as I say, a lot of our work, of course, is very much dependent on donor funding. But as I say, we're working on our next 5-year strategy, and India is certainly one of the countries that we have on our shortlist of countries to expand to.
Great. This is awesome. Well, we've been receiving greetings from Lucy from Kenya in East Africa and many others. We still have time for one more question. And it says, the approach of women is good, but what about men? They are usually doing the hard work, exposed to many ergonomic risks at a larger extent than women. Shouldn't you rather focus on them as well? It's a good question too.
It's a very good question. And maybe let me start, and then I'll hand it over to the experts in the field who probably have a much better answer than me. But, I think we're already doing that. I think that's the default. My sense is that if you look at the research that has been done on occupational safety and health and the hazards and risks, it focuses on sectors that are male dominated. It focuses on the high risk sectors, mining, fishing, construction. So we know a lot. We know a lot about the risks and hazards that affect these high-risk sectors that are male-dominated. I think the challenge for us is to really be able to focus also on sectors that may be women or female-dominated, because much less attention has been paid to that. It's often considered lower risk. And so there's much less research that has been done in that area. And so also, and as I mentioned at the beginning, you also have situations in which men and women do exactly the same work. And the default is to take the male worker as the model and to design your interventions around that person, whereas, much less focus on women. So, I hope I'm not too flippant in saying, I think that's what we're already doing. I think that's the bulk of work on occupational safety now is focused on the male worker, is focused on those industries that are considered high risk and which is male dominated. The challenge really is to do more work that is gender sensitive and that explores the risks and hazards that women workers are facing. So we're not ignoring men. We're not ignoring men. But we've just focused a lot, I think, on male workers.
Well, it's good to clarify that because, of course, all the male participation in all the fields are very as important as gender. But having gender now with these specific programs is wonderful. Lucy from Kenya is asking, Kenya recently joined the IWCA through the formation of Kenya chapter. I am a small scale grower and identify with all the problems that have shared on the presentations, but I have not seen any Zero Fund in East Africa. What can we do to participate in those trainings? She's from Kenya.
Okay,
No, you guys, I just want to say again that, under this global project that I mentioned to you earlier, Blanca, I think we're certainly looking at expanding into Africa. African countries are major producers of coffee. It's a big gap in our work in the coffee sector. So certainly that's, again, also on our radar. But I think already, and Rodrigo can maybe now talk about that, a lot of the work that he's done, he's been able to put online. We have a coffee toolkit that is freely available on our website. People can click on the tools, the methodologies, it's all there. It's really all there. And we're happy to assist and we're happy to guide, but that material we're making available at no cost. It's on our website. I think, Rodrigo, maybe that's what you wanted to add.
Yes, I comment that we developed 2 online free courses in our International Training Center for ILO. It's based in Turin. It's free. And one is focused on agriculture and chemicals. And another one is this wind methodology that we present in these slides. I encourage you to take this course because are free, are practical. They have a lot of information and I recommend you, okay? And for example, we have this kind of materials available.
And I think what we can do, Rodrigo, maybe just is to share, Blanca, with you and the colleagues the links to this so that you're aware of it. The toolkit in particular and the courses that Rodrigo is talking about. And certainly we'd be very happy to talk to the IWCA chapter in Kenya. We would very much like to expand our work there, in the extent to which we can already start the conversation, I think would be very helpful. So I'm very happy that we got that question. So thank you.
This is great, and certainly we're going to be pending on news and much more work to be done. So Maria, up to you. Can we wrap up?
Yes, I think we have got a lot of information and a lot of things to consider. And if you were not here for the first part of the webinar, this will be posted on our YouTube channel by the end of the week. So I know there's a lot of detail and great information that all of our panelists provided. I know I'm definitely going to go back through it to just do a second pass to really process the information. And I appreciate you all sharing your time. And I know we're kind of all scattered all over the world, so I appreciate you guys all coming together for this very important conversation. And we look forward to, the further research and partnership. And we just value our collaboration with ILO and Vision Zero Fund so much. So thank you.
Thank you. Thank you very much, everyone. Thank you, Maria.
Thank you. Thank you, everyone.
Thank you.
Bye-bye. Bye-bye. Thank you.
Thank you.